Medication for every nation, treat the people now. Medication for every nation, treat the people now.
I'm here today to take part in the March for Universal Access. We were promised universal access by 2010. 2010 has arrived, but we are very far from universal access. In fact, we see a backtracking on the commitment to AIDS.
AIDS drug saves lives from the fund now.
Leaders of governments are meeting at the UN General Assembly and the MDG Summit. I'm here today to ask those governments to actually follow up on their commitments to universal access. 4 years ago, they committed to trying to achieve universal access to AIDS prevention, treatment, and care and support. And they've really not succeeded in doing that.
The International Treatment Preparedness Coalition recently issued a report showing how this retreat on global funding is causing AIDS treatment waiting lines, people waiting to get treatment, doctors to make choices between whether to treat the mother or the child. And this is also leading governments across Africa and Asia and Latin America to cut their own budgets for health and for HIV/AIDS treatment.
No way. Treat the people, don't delay.
Back in my country, a lot of people are living with HIV, but just a few people which are accessing this treatment. People are walking long distances to access this treatment, and people are not even eager to go for voluntary counseling and testing because they don't know tomorrow am I going to have this treatment. And today the leaders are saying no, we can't fund that. It's quite a pity. It's quite frustrating.
Donors have shown an incredible amount of cowardice over the last several years. The response to HIV has been one of the most productive and effective results-based investments in development. To dismantle or attempt to undermine that response now, when we're on the verge of showing such real and lasting success, is so extraordinary and outrageous.
Million dies of HIV, make pills a priority.
AIDS is not just simply a health problem. It weakens the economy, it weakens society, it weakens communities.
AIDS drugs save lives, fund the fund now.
Doctors are beginning to protest as well because they're having to make impossible choices about who to treat because there simply aren't enough drugs and there simply isn't enough money to make universal access to HIV treatment a reality.
People live with HIV and AIDS in São Paulo, which is, the most developed state, the capital of the most developed state in Brazil, are having trouble to access their treatment. And Brazil is a country that has universal access for treatment. Of course, it's not related to funds itself, but it's related to management.
The Russian government has to wake up and see what's going on in the country and see that people are not getting prevention. The epidemic is getting worse. We don't have harm reduction. We don't have opiate substitution treatment. And also we don't have good quality, uninterrupted HIV treatment. And the government has to take care of this situation. A country which presents itself to the world as developed, as civilized, as being able to take care of their own citizens should really do that.
I'm a person living with HIV and AIDS. If my country does not get enough money, they'll be able to put money into treatment for HIV. What happens if I have TB? So after adhering to my treatment, my HIV treatment, TB will come along and kill me.
Tuberculosis is the highest killer of people living with HIV, and if we intensify screening of tuberculosis in people living with HIV, it means we'll be able to contain tuberculosis, make treatment available. So we've made tremendous strides. The Global Fund has treated and tested 7 million people for tuberculosis.
The Global Fund to Fight AIDS, TB and Malaria, which was set up in 2002 as an exceptional response to an exceptional problem, which is HIV/AIDS, is once again financially being bankrupted.
Medication for every nation, treat the people now. Medication for every nation, treat the people now.
If we look at when the AIDS epidemic first came about, people were dying in numbers, but because antiretroviral treatment is now available, people have stopped dying. Not to invest money in the Global Fund means we'll have wasted the investment that we started making in the year 2002.
I'm one of the people that has benefited from the Global Fund. If it wasn't for the Global Fund, I wouldn't have been here. Because I lost my husband in 1991 because there was no treatment then.
Now, so much good has been done so far around HIV, and if we slow down or if we stop, then all that good is going to be taken away.
People forget, and governments forget, that actually means people's lives. That actually means people will die because they've decided that they've given enough.
And in my country, the mother-to-child transmission accounts for 30% of the new infections. And if the funding was to be provided, by 2015 we would be in a position to totally eliminate the transmission of HIV from mother to child.
There is a trend now at the international environment to say that HIV and AIDS has a lot of money, which is not true. So I think first thing is to say people that we never have the money that we need to have.
So the basic message that we're bringing here is, you've committed as governments throughout the world, both developing country and donor governments, to actually fund treatment access. There's a commitment to universal access to treatment along with prevention and care and support. So really they need to fulfill that.
So our earnest appeal is that the world leaders should not look at this as a case of looking at numbers and digits in terms of how much money it's going to cost. We're talking about saving people's lives, and there's nothing more precious than saving people's lives.
No way! Don't delay!
I'm Aditi Sharma from the International Treatment Preparedness Coalition, and I'm from India.
My name's Banza Chela. I'm a health activist from Zambia, and I represent the Treatment Advocacy and Literacy Campaign.
I'm Kieran Daly, the Executive Director of the International Council of AIDS Service Organizations, or known as ICASO.
My name is Karen Awina Nyirenda, and I'm the National Coordinator of the Community Initiative for TB, HIV and Malaria based in Lusaka, Zambia. But I'm also the board member representing communities infected by HIV, affected by TB and malaria on the Global Fund board.
My name is Anya Sarang, and I work with Andrei Rylko Foundation for Health and Social Justice in Moscow, Russia. And we are all part of ITPC in Eastern Europe and Central Asia.
My name is Michael Guava. I come from Zambia. I work for an organization called the Community Initiative for Tuberculosis, HIV, AIDS and Malaria. But I'm also a volunteer with the Treatment Advocacy and Literacy Campaign.
My name is Alessandra Nilo. I'm based in Brazil, and my organization is Gestus, and I'm also a member of ITPC.
My name is Asia Russell. I work for HealthGap, the Health Global Access Project.
And where are you based?
I'm based in Kampala.
My name is Joyce Kamwana. I'm from Malawi, which was one of the countries in sub-Saharan Africa most hardly hit by HIV, AIDS, TB and malaria. I'm here as an ambassador for the Here I Am campaign. Basically, we're trying to tell our stories and providing a face and a voice for representing about 5.7 million people that are alive today because of the Global Fund.
AIDS drugs save lives, fund the fund now. All right?
AIDS drugs save lives, fund the fund now. AIDS drugs